Anemia and homeopathic medicine. The number of red blood cells decrease in the blood is called anemia. A person who has anemia is called anemic. There are three major types of anemia. First, if the red blood cells are smaller than normal, this is called microcytic anemia. The major cause of this type are iron deficiency, low iron level. Second, if the red blood cell size normal but low in number, this is called normocytic anemia. Third, if red blood cells are larger than normal, then it is called macrocytic anemia. Anemia causes. Common causes of anemia include: first, anemia from bleeding. Loss of blood through heavy menstrual bleeding or wounds can cause anemia. Second, iron deficiency anemia. The bone marrow need iron to make red blood cells. Iron play an important role in the proper structure of the hemoglobin molecule. If iron intake is limited or inadequate due to poor diet intake, anemia may occur as a result. This is called iron deficiency anemia. Iron deficiency anemia can also occur when there are stomach ulcer, chronic bleeding, colon cancer, uterine cancer, intestinal polyp, hemorrhoid, etc. Third, anemia related to kidney disease. The kidney release a hormone called the erythropoietin that help the bone marrow make red blood cells. The production of this hormone is diminished, and this in turn diminishes the production of red blood cells, causing anemia. Fourth, anemia related to poor nutrition. Vitamins and minerals are required to make red blood cells. In addition to iron, vitamin B12 and folic acid are required for the production of hemoglobin. Poor diet intake is an important cause of low folic acid and low vitamin B12 level. Fifth, pernicious anemia. There also may be a problem in the stomach or intestine leading to poor absorption of vitamin B12. Vitamin B12 deficiency known as pernicious anemia. 6. Sickle cell anemia. It's also cause of anemia. 7. Alcoholism. Poor nutrition and deficiencies of vitamins and minerals are associated with alcoholism. Alcohol is toxic for bone marrow and slow down the production of red blood cells. This condition may lead to anemia. 8. Thalassemia. This is another cause of anemia. 9. Bone marrow related anemia. Anemia may be related to diseases involving the bone marrow. Some blood cancers such as leukemia or lymphoma can alter the production of red blood cells and result in anemia. 10. Aplastic anemia. Some viral infection may affect the bone marrow and diminish production of all blood cells. Hemolytic anemia. Hemolytic anemia is a type of anemia in which red blood cells rupture, known as hemolysis, and become dysfunctional. 12. Anemia related to medications. Many common medications can occasionally cause anemia as a side effect in some individuals. Medications that most frequently cause anemia are chemotherapy. Chemotherapy drugs used to treat cancer. Chemotherapy induce anemia. Other common medications that can cause anemia include some severe medication, transplant medication, HIV medication, malaria medication, and some antibiotics. Other less common causes of anemia include: first, thyroid problem; second, cancer; third, liver diseases; Fourth, autoimmune diseases. Fifth, hemoglobinuria. 6, AIDS. 7, malaria. 8, parasitic infection. 9, viral hepatitis. 10, bleeding disorders. Symptoms of anemia: fatigue, decreased energy, weakness, shortness of breath, palpitation, looking pale. Symptoms of severe anemia may include chest pain, angina, heart attack, dizziness, fainting, tachycardia, low blood pressure, enlargement of the spleen. Homeopathic medicine for anemia. First, alfalfa. Alfalfa is a good source of vitamin B, C, D, E, and K. Alfalfa is also rich in the mineral calcium, potassium, phosphorus, and iron. Alfalfa Q is best medicine to increase HP level. Homeopathic medicine to control palpitation in anemic person. Ferrum mat and natrum mare are the best medicine to treat palpitation in anemic patient. Homeopathic medicine for anemia with weakness. Ferrum mat, China, and natrum mare are very beneficial in treating weakness in anemic patients. Homeopathic medicine for anemia during pregnancy. Ferrum phos is best for all women during pregnancy suffering from anemia. Second, Aletris farinosa is the ideal homeopathic medicine when extreme weariness, tiredness, fainting, and vertigo are the symptoms. These are safe remedies during pregnancy. Homeopathic medicine for anemia due to nutritional disturbance. Alumina, Nux vomica, and Calcarea phos, best homeopathic medicine for anemia due to nutritional disturbance. Alumina is best remedy when there is gastric problem and the person remain constipated. There is desire for chalk, coffee, and other indigestible things. Nux vomica symptoms: constipation, heaviness in abdomen after eating. Calcarea phos, homeopathic medicine for anemia due to weak digestive power. Abdomen is full of gas. Next, homeopathic medicine Ferrum phos, a hemoglobin enhancer. Ferrum phos is the best medicine to increase the hemoglobin level. Homeopathic medicine for pernicious anemia. The top natural best homeopathic medicine for pernicious anemia are picric acid and phosphorus. The symptoms of picric acid are extreme weakness with a tired feelings. Second, tingling in limbs with needle-like sensation. Phosphorus, homeopathic remedy for anemia when there is numbness of hands and arms. China, one of the best homeopathic medicine for anemia due to excessive bleeding. The bleeding can be the result of a traumatic injury. Excessive bleeding in periods or bleeding from any part of body like throat, bowel, nose, etc. Another medicine, Melifolium, used for epistaxis, nose bleeding, which caused by anemia.